Colleagues, very good afternoon to you. A very warm welcome to this WHO Africa and APO group press briefing, online press briefing on COVID-19. As you know, we've been holding these almost nightly. So today's press conference will take a look at people living with non-communicable diseases, and we'll tell you about how people living with NCDs are more likely to suffer severe cases of COVID-19. We're talking about people with diabetes and hypertension, but of course you'll hear a lot more from the experts in just a moment. But just a quick reminder that please use the Q&A function of the Zoom app to pose your question. You'll have to identify yourself and the organization that you're representing. The broadcast is simulcast in both English and French, so please look at the globe icon at the bottom of your Zoom app and you can choose your preferred language. So Francois will translate that for us in French.
Bonjour et merci de vous être connectés. Pour pouvoir suivre la conférence en français, vous pouvez utiliser la fonction d'interprétation de Zoom. Pour ce faire, vous devez cliquer sur le petit globe dans la barre d'outils et choisir le français. Merci.
Thank you, Francois. So as we mentioned that we're talking about non-communicable diseases and how people with these are at higher risk of severe COVID-19 cases. To hear from the experts now, Dr. Moeti is the WHO Regional Director for Africa. She joins us from Johannesburg. In Lusaka is Dr. Aggrey Mweemba, who's the head clinical care at Levi Mwanawasa University Teaching Hospital. And in Nairobi, Kenya, we welcome Dr. Mary Amuyunzu, who is the Executive Director, African Institute for Health and Development. Dr. Mary Amuyunzu-Nyamongo, welcome to you all. And just to mention that Dr. Moeti is also joined by Dr. Jean-Marie Dango, who is the coordinator NCD program, WHO Regional Office for Africa. There are other experts as well on hand to speak on some of these subjects, but let's first start with Dr. Moeti, who's going to just talk us through the challenges that countries face with regards to this. Dr. Moeti, the floor is yours.
Yes, good morning, and thank you so much, Tsepiso. Good morning, good afternoon, and thank you all for joining us for this press conference. I'm very pleased to be joined by my colleague and friend, Dr. Mary Amuyunzu-Nyamongo, the Executive Director of the African Institute for Health and Development in Kenya, and also by Dr. Aggrey Mweemba, the Head of Clinical Care at the Levi Mwanawasa University Teaching Hospital in Zambia. Thank you so much to the two of you for joining us today. This week is a global week for action on non-communicable diseases because the burden of cancers, diabetes, cardiovascular and respiratory diseases is rising in Africa and also globally. Yet NCDs, as we call them for short, remain the most underfunded public health issue. The COVID-19 pandemic has reaffirmed the importance of everyone having access to needed quality health care that they can afford. However, in African countries, although NCDs may be part of national essential packages of health services, often payments for medications and treatments are made out of pocket directly by families to providers. This means, particularly for low-income households, that NCD services can be out of reach. When someone has a chronic disease, it's often up to their family to ensure lifelong care. And partly because of late diagnosis, Africans tend to die younger of cancer and cardiovascular diseases than people in other parts of the world. Preventive interventions relying on public policy and legislation need a lot more investment and work. We know that the COVID-19 response is impacting other essential services, and NCD diagnosis and treatment is among the most frequently disrupted health services globally. In a rapid survey by WHO, 41 participating countries in the African region reported disruptions to NCD service delivery. This is a concern because disruptions in NCD treatment can result in death on their own, and because people living with NCDs like diabetes and hypertension are at greater risk of severe illness and death when infected with COVID-19. In Kenya, for instance, 50% of COVID-19 related deaths have occurred in people living with NCDs, and in the Democratic Republic of the Congo, it's as high as 85%. Protecting people from infection as part of COVID-19 prevention and ensuring NCD prevention and care as part of essential services can reduce the progression of cases to severe disease and death. As with COVID-19, the prevention of NCDs requires multi-sectoral action and informed, engaged, and enabled communities backed by strong public health policy, including legislation. More broadly, strengthening preparedness capacities in line with the international health regulations and health promotion in countries are both smart investments for countries to accelerate progress towards the health-related sustainable development goals. At WHO, we've developed guidance for countries on NCD prevention and management in the context of COVID-19 and are advising on strengthening NCD service availability, including through scaling up the use of telemedicine in order to reach people and to reach healthcare workers among themselves in sort of supervision by those who are more qualified or people working at the primary care level. Going forward, continuity of essential services remains a key pillar of the COVID-19 response. We should also use an integrated approach on risk communication and community engagement to educate people on the dangers of discontinuing NCD treatment and on prevention measures for both COVID-19 and NCDs. In addition to strong public health capacities, engaged communities, and action to address the socioeconomic impacts of COVID-19, focusing on strengthening health systems and essential services can help societies and economies to open up safely. And we know that that's where most countries are now. In closing, I'd like to mention a very important development in our response to COVID-19, which is our launch today with the Africa CDC of a new network of laboratories in Africa that will work on genome sequencing of the SARS-CoV-2, the virus that causes COVID-19. This network will help us to track the evolution of the virus, to better develop vaccines and treatments tailored to African populations, and it will also help us to stay a step ahead of COVID-19. Also today, WHO is launching a high-level facilitation council, which will support the COVID-19 Tools Accelerator and help to achieve the rapid development and distribution of COVID-19 vaccines, treatments, and tests. This is taking place with the support of the leaders in Africa. Thank you very much, and I look forward to our conversation today. Thank you. Tsepiso, over to you.
Thank you very much, Dr. Moeti. As you mentioned, a very serious issue which affects, you say, 41% of the countries that took part in your study reported disruptions of NCD treatment, and to talk a little bit more about the kinds of treatments there are and how they've been tackling that not only in Lusaka, but what we as Africans ought to do. Dr. Aggrey Mweemba is in Lusaka. Dr. Mweemba, it's over to you.
Thank you so much, Tsepiso. Good morning and good afternoon. So first of all, just give you an overview of our center. So Levi Mwanawasa University Teaching Hospital COVID Center is a new wing hospital, which at the moment has about 820 beds, 12 ICU beds, and 4 high dependence unit beds. The current space opened up for COVID-19 is about 290 beds. On average, we have about 30 to 95 patients admitted at any given time. And of these, diabetics, we have about 33% at any given time. And most of them are non-diabetics, and we have new onset diabetics because of COVID. 40% of these have hypertension, and again, these are either non-hypertensives or new onset hypertension. So COVID seems to induce both new onset diabetes and hypertension. Our mortality crude at the moment is at less than 1%, and the majority of our patients die from NCDs and especially diabetes and hypertension. How do we manage these patients? So I'll start first of all with diabetes. So most of them will either come with mild, moderate, or severe diabetes, and I believe this is true across Africa. And therefore, the management for each of these conditions will differ slightly. We monitor on a daily basis each of the patients, and all the doctors and nurses, they have to report on each patient the sugar for that day and the BP for that day. Those who are diabetic, we try to stabilize the glucose levels. And because most of them are inpatients, so we sometimes stop what we call oral tablets that they are taking because insulin is better. And so we tend to use insulin to stabilize them. There are main factors that might lead to diabetes. For example, some of the drugs that we give them might induce diabetes. The inflammation that goes on might induce diabetes. And just the virus itself might induce diabetes. So the doses for the insulin will depend on the level of the sugar. And so we tend to use more insulin than other tablets. We sometimes still continue some tablets in those that we think are very stable. But like Elia said, is that we use insulin more than the tablets. We do see hypertension, as Elia mentioned. And even for hypertension, we still use the conventional medications. We do take care that just giving antihypertensives in people that have just been diagnosed with hypertension, we have to be a bit careful because some of them, this hypertension might just be anxiety induced, and therefore we monitor them closely to ensure that we don't drop the BPs very high. But we use conventional medicines. I think that the protocols across Africa are the same, and I believe that the way we manage them is dependent on the current protocols that we follow. And so basically, this is the outline of how we manage them, and I'll wait for more questions going forward. Back to Sepiso, please.
Thank you very much, Dr. Mweemba. So let's talk about the patient perspective now. Dr. Moeti mentioned earlier on that it's a costly exercise, especially for low-income houses, many of them paying out of pocket. She says Dr. Mary Amuyunzu-Nyamongo is going to talk to us about this. It's over to you, Dr. Nyamongo.
Thank you. Good morning, good afternoon. In terms of non-communicable diseases across Africa, by the time we started recording COVID cases, the message was already out there. If you have a comorbidity, if you have an underlying condition, you are susceptible to severe disease or poor health outcomes. And therefore, from the beginning, there was a lot of fear. So if you are living with diabetes, if you are living with hypertension, if you have sickle cell, you have asthma, you already were a scared patient. And the stories we hear across the region is that if then you are a patient with diabetes, you are confronting this new disease from a point of fear. Your caretakers are also worried. What do we do with this person? Your family members are very worried about exposing you to COVID-19. So among patients of NCD patients, there was a lot of apprehension. And I like Dr. Aggrey talked about anxiety. So you are already a patient, you are anxious about COVID, you go into hospital, you really are scared that the outcomes may be severe because that's the message we seem to have received from the beginning. Secondly, when we started managing, as government started managing COVID-19, we had restrictions, movement restrictions. People lost jobs. Some of our patients, especially those in informal settlements, type 1 diabetes patients who are on constant insulin supplies, couldn't access insulin. Also, Dr. Moeti talked about out-of-pocket payments. And so the job losses, the limitations in movement, the fact that we had curfews in a lot of our countries running from late evening to early mornings. Again, that restricted movement, job losses, it meant that some of the patients couldn't afford care. And thirdly, those limitations in movements and the closure of airspace also meant limited supplies. And we've had some cases where we've had stockouts in terms of medicines for some of the non-communicable diseases. And fourthly is the fact that it has really affected health-seeking behavior. In fact, across the region, you've had people not going to hospitals, even for regular checkups, even for clinics, for antenatal care, for regular diabetes clinic, and mainly because the services also shifted to COVID care, but also people got scared of going into hospitals. Because then we had nurses are also getting infected, the health workers are getting infected. And so if you have a patient of diabetes with diabetes or hypertension, do you really want to take that risk of taking this patient to a hospital? So for patients with NCDs, the mental health status is something that I think we need to focus on. How are they coping, not only with the conditions, but also with the fear of getting infected? And we've told them over and over again that because they have an NCD, the health outcomes may be more severe, or they'll have poor health outcomes in terms of mortality. As Dr. Moeti said, some of our countries, the mortality for COVID-19 is skewed towards people with non-communicable diseases. So this information goes out. We are living in a context where access to healthcare is limited, and therefore the mental health of these patients, the anxiety among the patients, the fear among the patients is very high. And as a region, we do need to begin to address some of these anxieties that have been caused through COVID-19. So as we speak about this, let's think about access to care. Let's think about how do we provide psychosocial support for patients with NCDs so that they can deal with it. If it's controlled, if your condition is controlled, you can get over it. If it's not controlled, then you do need to take specific measures to ensure that you don't expose yourself to COVID. Thank you. Back to you. Thank you.
Thank you very much, Dr. Nyamongo. We're going to take questions now. Please, colleagues, remember to use the Q&A function on the Zoom app to pose your question. Please indicate to whom you'd like to pose a question, to identify yourself and your organization, please. So we've already got some questions coming through, so we'll come back to you, Dr. Nyamongo. We've got a question from Effie Mpande from Zambia National Broadcasting. I'll pose the first question to you, and then Dr. Moeti, you can answer the second question. But let's start with the first question from Effie. It's about what NCDs do to the body, especially considering COVID-19. And Dr. Moeti spoke about the issue of late diagnosis earlier on, and if he's seeming to suggest that a lot of people only seek medical attention when they're experiencing complications. Dr. Nyamongo, is that what you've found?
I'll defer that question maybe to Dr. Dango to respond to that. But my understanding is then you have lower immunity if you have uncontrolled diabetes or an uncontrolled NCDs. So lower immunity means you're more susceptible to the infection, to COVID infection. And that's why we advocate for patients to take care not to expose themselves to the virus, because their immunity levels are already low and therefore they are highly exposed to the virus. But I'll ask Dr. Ndango to respond to that.
But are you finding, though, that patients are only getting treatment after the fact when they're experiencing complications? You mentioned already that there's a great deal of anxiety of people who already know that they are either diabetic or hypertensive, but are people only finding out about their status because of COVID-19 from your experience, Dr. Nyamongo?
I think from our experience in Kenya and in a lot of the countries, actually, people really don't do regular screening. And so in some cases, somebody, there's a doctor who passed on, and only then did they find out that she had diabetes that she was not diagnosed. So some of the patients are finding out about their underlying conditions when they show signs and symptoms of COVID and they go for the test. And then during that is when they find out maybe they had diabetes, they didn't know, their blood pressures were elevated initially, but they had not gone for screening. Again, just in terms of health seeking, we tend not to go for screening unless there's a problem. And therefore, some of them are finding out currently that they have the condition. The other challenge has been the fact that with testing in a lot of our countries, the testing hasn't been rolled out to the mass. We are not doing mass testing, and therefore you only go for a test if you have a sign or a symptom of COVID, or it's recommended by your doctor. So some people are finding out about their COVID status only when they already have symptoms of COVID-19. Thank you. Over to you.
All right, thank you. Dr. Moeti, the second part of Effie's question is around what African countries can do to ensure that they're not overwhelmed by NCDs. You spoke about preventative measures and policy earlier on. Perhaps you'd like to expand on this.
Sorry, I couldn't quite hear what you were saying. Could you?
Okay, so the question, Dr. Moeti, is around what African countries can do to ensure that they're not overwhelmed by NCDs. I'm saying you spoke earlier on about preventative measures and policy. Would you like to expand on that?
You know, I think the truth of the matter is that African countries are facing what we sometimes call a double burden. Some people even call it a triple burden, because we still have a quite significant burden of infectious diseases, communicable diseases like malaria, like HIV, like tuberculosis. But at the same time, we have an increasing burden of these non-communicable and chronic conditions. And so there is need from countries which have limited resources. We know that we have a large number of low-income, least developed countries in Africa, of having to deal with these two problems at once. And I think we need to acknowledge that at the moment, the kind of attention, the prioritization, and the financing of action on NCDs, both in terms of prevention and providing access to treatment, is lagging behind and requires much more effort in order for us to be able to stem, in fact, the evolution of the pandemic of non-communicable diseases, which is already the main cause of death at the global level. But in Africa, I think we could see it coming while we were trying to deal with communicable diseases. And our view is that some actions have been taken. So for example, many countries in Africa, most countries have a national strategic plan on NCDs in Africa. Many countries have signed on to the Framework Convention on Tobacco Control. And we know that tobacco is one of the biggest drivers of non-communicable diseases, both in terms of cancers, chronic lung diseases, and cardiovascular diseases. Some countries have done some work to increase the taxation of alcohol, which also has an important impact on health. And countries are trying to promote healthy lifestyles, exercise, etc., healthy diets, as well as provide basic care, encourage early screening for their populations on NCDs. I think that we're at a kind of tipping point as to how to accelerate and do better and go faster in dealing with NCDs on the African continent, particularly in the African region, sub-Saharan Africa. We don't have a global financing instrument for chronic diseases as we do for some of the communicable diseases. But we think in WHO that, you know, the big emphasis that's been placed on universal health coverage, having a good health system that both is resilient to outbreaks like the COVID-19 pandemic and can provide basic care, is a big opportunity just to integrate the aspects that deal with NCDs in a system that is overall well-funded. So in fact, I can say that it's a big challenge for African countries at the moment. the COVID-19 is reminding us in a very significant way of the importance of dealing with non-communicable diseases. And my hope is that we will, as countries in Africa, take this opportunity then to make the link in terms of a strategic integration into well-funded services, maybe leveraging some of the monies that are available for infectious diseases, where investment is supposed to improve the system and speed up the progress in bringing under control, especially preventing chronic diseases. This is my view on that question.
So Dr. Moeti, while you still have the floor, we have a question from Lucy Mouliard from Radio France International, and they want to know if you could please just talk a little bit more about the network of laboratories that were launched today.
Laboratories that are? Sorry.
The network of laboratories that were launched earlier, that you mentioned were launched today.
Oh, yes, the sequencing network that we've established with the Africa CDC. So we have around the region identified a number of laboratories that have the capacity to carry out gene sequencing and kept them working together in order to share information about the subtypes of the virus that they are finding, so that we have a regional picture in addition to having national pictures from some of these labs of what is going on, what is the subtype that is predominant, if there are any changes that are happening in this virus, so that we can, in a sense, understand what to anticipate as part of the response to this in African countries. So we have labs in countries like South Africa, Kenya, some of the Senegal, some of the North African countries like Morocco, others, I believe Zambia, we have a lab, Ethiopia, we have labs involved in this. So the idea is just that we in Africa need to form our own picture of what is the subtype of the virus that is predominantly circulating here. We need to know about transmission of the virus between African countries from studying the subtype of the virus. And I think this is an extremely good initiative, and we hope to grow this capacity in the African countries so that we can understand in more depth what we are facing in the pandemic.
Thank you very much, Dr. Moeti. So Dr. Aggrey, let's bring you back into the conversation. Catherine Chisompola is from Radio, I don't want to butcher it, I think it's Chengelo in Zambia. So what Catherine wants to know is, what are the major contributing factors to the growing problem of diabetes and hypertension in Africa? And perhaps we can share the Zambian examples. I know you did. You spoke about how COVID-19 brings about the onset of both, but if you could just talk a little bit more about this and how patients are finding that their medication have run out, what would you suggest they do in the interim?
So, I guess the question is about NCDs and COVID, not in the general. So yes, COVID itself, So COVID itself, for example, I'll start with the diabetes. So COVID itself does infect what we call an organ called the pancreas, and the pancreas is important to control sugar in your body. It looks like COVID actually does damage the cells of the pancreas, and therefore you are unable to produce enough chemicals that can control your sugar. So COVID can induce diabetes on its own by damaging this organ called the pancreas. At the same time, because of the immune system, that diabetics have an immune system that is abnormal, so they fail to defend themselves very well. As a result, the virus can easily go in and multiply very fast, therefore damaging this organ and therefore causing high blood sugar. At the same time, like I said earlier on, there are certain drugs that we do use to suppress immunity. There are drugs like dexamethasone. We use it on almost all the patients that are admitted in the center. These drugs on their own can induce hyperglycemia, or what we call high sugar levels. And so this is another reason why COVID patients would develop diabetes. But once you stop the drug, we expect that the sugar will also be controlled. The other reason is that the virus itself induces an immune response that is overwhelming to the patient. Now, because of this immune response, the body fails to control the sugar. And so the sugar tends to go up. Then I'll come to hypertension. The virus has a special protein that it uses to enter the body during transmission. And this special protein called the ACE2 is very important for blood pressure control. So in the presence of the virus, it seems that the body fails to control BP, and therefore your blood pressure will go very high because of the virus that has infected you. So COVID virus does actually induce both diabetes in an individual that is already diabetic, and it can induce diabetic in an individual that is prone to diabetes. So a non-diabetics, for example, for the first time can present into the hospital with diabetes. And a non-individuals that have no hypertension previously was tested okay, and the BP was normal, for the first time because of COVID, they can present with hypertension because of these reasons that I've explained. What are the gaps in terms of our management? Is that obviously that countries in Africa have not budgeted for the NCDs due to COVID. And so all their budgets are essential drugs just to manage normal NCDs. And therefore, as we manage these patients, we are pulling a lot of resources from the little resources that we have. And therefore, this is straining African governments a lot.
All right, thank you very much, Dr. Mweemba. I think it also answers Sandra Kunda's question, Sandra Kunda from Radio Mano, because she's basically asking if someone can develop COVID or NCD diseases from having COVID-19. So Sandra, I hope you understand. I think your question has been answered there. So let's go to the next question here from Anita Powell from Voice of America. Dr. Moeti, this question is to you. And what Anita wants to know is, can one of the experts, you and of course any of the other experts, explain the significance of South Africa having paused its vaccine study in light of the medical event in Oxford? And could this delay the end of the pandemic in Africa?
Okay, yes, thank you. Thank you for that question. We have been informed about the temporary pause of the clinical trials led by the AstraZeneca in collaboration with the University of Oxford after one of the volunteers, a healthy volunteer, developed severe illness following having been vaccinated with the virus. Of course, we know that one of the purposes of a clinical trial is to identify exactly this possibility that there may be adverse effects, as they are called, in the use of a tool. And it's one of the key purposes. One, we want to find out, is the vaccine effective? Does it convey immunity? And then secondly, is it safe to use? Does it cause adverse effects? And in this case, very correctly, when it was found that a volunteer who had been healthy developed developed an illness, this the study has been halted for the moment or paused, and that there's going to be work done to understand what is going on with this person, perhaps to see if other people who are subjects may also have had similar problems. It's very, very important. And I think what this should be regarded as something that you might expect in the course of a clinical trial. So it should not cause us to panic that this could be something that could, if you like, doom forever the discovery of a virus, or even finding out how this, of a vaccine, finding out how this vaccine might be adjusted or adapted. I think the most important thing is for us to make sure that every possible adverse effect is found out, will this delay the end of the pandemic in Africa? I think we should know that there is a number of vaccines that are being trialed at the moment. This vaccine is only one of 9 candidate vaccines that have entered into the phase 3 of their trials. We hope that this issue will be resolved, but there is hope, I think, that we'll arrive at a balance that's both effective and safe to use, and we can go ahead to address the pandemic worldwide, including in Africa.
Thank you, Dr. Moeti. This next question is to you, Dr. Nyamongo. It's from Bernadine Amutanu from Daily Nation in Kenya. So what she wants to know is about the stockouts for NCD medication that she spoke about earlier on. What is the situation, Dr. Nyamongo, she wants to know. And also the fact that you mentioned that NCD patients had anxiety and were fearful of going to hospitals because of the risk of contracting COVID-19. Has the situation improved?
Just to answer the second question, the situation has improved since the airwaves were opened and flights were able to land in the country. The stockouts have been resolved. And for people who are scared or worried about getting exposed to the virus in health facilities or on their way to health facilities, there have been innovations where you can consult with your doctor through the phone telemedicine, and there are also innovations with some riders bringing the medication back to the places where the patients are. So we've seen some innovation, we've seen some partnerships that have been forged between health facilities and civil society organizations and doctors in terms of accelerating access to treatment for patients of NCDs, especially those who are on routine treatment. The challenge continues to be costs of treatment. So that is still a challenge for patients who lost their jobs, for patients who cannot afford their regular treatment or their regular visits. That continues to be a problem. And I think this is increasingly so across the region because the economies haven't opened up. And if somebody lost a job in March, by now even savings have been depleted. So just increasingly asking ourselves, how can the governments then step in to ensure that these patients on routine treatment, patients on chemotherapy, patients on dialysis and radiotherapy, on the other hand, can also get access to treatment, given the fact that the economy is not doing very well. And so just to answer, the stockouts have been reduced because of the increased access to air travel, but access in terms from individuals accessing treatment, that continues to be a challenge for some of the patients, especially from the poor households. Thank you.
Thank you, Dr. Nyamongo. So we've got a question here for Dr. Moeti. It's from Cédric Gavenier from Afrique Magazine France. Dr. Moeti, so Cédric wants to know which of the 8 African countries have agreed to self-finance their vaccine doses through the COVAX platform. And he also wants to know what the funding objectives are and how close are we to reaching them?
Okay, thank you very much. So if he can please excuse me for a minute, I just wanted to add something to what Mary said around the issue of the challenge to delivering essential services and people being afraid to attend health facilities. That WHO has developed some guidance on how the delivery of essential services can be continued safely without increasing the risk of the transmission of COVID-19. And it's very much around observing physical distancing in the process of delivering services. So it means that the scheduling of sessions of service delivery has to be expanded, extended, and also there is the encouragement where possible of kind of outreach services so that people don't have to congregate and come to the clinic and queue and wait in proximity to each other. Some countries are carrying out what we call triaging, So making sure that at the entrance, people who have symptoms that might be suggestive of COVID-19 are directed in one way, and then other people are directed in another direction, so that then the risk is minimized. Just to emphasize that we are very much encouraging people to continue to seek treatment in different ways, including, of course, by telemedicine, where it's a possibility, by the use of technology for the delivery of medicines. We're encouraging doctors as well for people with chronic diseases to provide them with their treatments for multiple months, as opposed to asking them to come in, for example, every month, just to minimize people being together. I just thought this is very important, because we do want not to have people dying of or being severely ill of other diseases because of the fear of coming to health facilities. So the question was asked, which are the countries that have agreed to self-finance, in a sense? And just to say that this COVAX facility is being coordinated very much with the leadership of Gavi, the Vaccine Alliance, which already is supporting access to financing for vaccines for low-income countries. So it's largely the middle-income countries that are having to contribute directly. And so the group of countries that we find that have agreed to do this are particularly the upper middle and some lower middle income countries, including Equatorial Guinea, Botswana, Gabon, Mauritius, Namibia, Seychelles, and South Africa. These are some of the countries that have agreed as part of this COVAX partnership to self-finance, and therefore to manifest their interest in having access to the vaccines, in our joint endeavor to make sure that there is equity in access to vaccines between upper income countries, between middle income countries, and of course between low income countries that will need support of their partners in solidarity to gain access to the vaccine. As for what is the target, and is the COVAX near to achieving the target, the latest information that we have is that what is being targeted is to mobilize $2 billion minimum, with which the COVAX facility needs. And up to today, what has been mobilized so far is $700 million. So we are at less than 50% of the target at a minimum to be reached. So there is a great deal of work to be done to diversify the possible sources of funding. And I think there is a lot of room for global solidarity to try to make sure that we have access all over the world to this vaccine, which is a tool, or to vaccines, which are tools that we need to deal with the collective vulnerability of everybody, every country in the world to the COVID-19 pandemic. Thank you.
Thank you very much, Dr. Moeti. So, as we mentioned, Dr. Jean-Marie Dongo is also part of the briefing, and this question is to you from Big Guy, Mark Kada of Cameroon. And basically, what they want to know is whether there is a framework for strengthening people's literacy, especially around chronic diseases such as the ones we've been speaking about, especially in the local context. And these are in areas of poverty, conflict, where there generally is low literacy.
Thank you very much for the question. Good morning, colleagues. Good afternoon, depending on where you are. Yes, the issue of literacy with regard to NCDs in Africa is a very important one. And so if I go back to the 30th General Program of Work of WHO, there is a very big and strong pillar related to healthy populations, where we do have specific programs related to health literacy, health promotion, community sensitization, and community engagement. So these are very important domains with regard to NCDs prevention, where we are involved into. In the same manner, countries are also having the same pillar in the Ministry of Health. And so they are really involved in improving the health literacy of the population with regard to NCDs prevention and control. And the prevention, it's not only dealing with risk factors, but it also encompasses social determinants of health, economic determinants of health. So these are what I can say with regard to improving the health literacy of the population in the area of NCDs prevention and management.
Thank you very much, Dr. Dango. If I could please ask you to also, for the benefit of our French colleagues, to also help with sound bites, etc. If you could just say that again in French, if you don't mind.
Mes collègues parlant français, la littératie des populations est très importante dans la lutte contre les maladies non transmissibles. Et j'en prends pour preuve le 13e programme général de travail de l'Organisation mondiale de la santé qui consacre tout un pan aux populations en bonne santé. Et dans ce pan du 13e programme général de travail, nous avons des programmes spécifiques qui concernent la littératie des populations en matière de santé en général, mais plus particulièrement dans la prévention et le contrôle des maladies non transmissibles. Nous nous occupons aussi de la promotion de la santé, de la sensibilisation et de l'engagement communautaire, tout domaine qui s'intéresse à augmenter la littératie des populations par rapport à la prévention et le contrôle des maladies non transmissibles. La même structure s'observe aujourd'hui au niveau des ministères de la santé des pays africains, où la littératie en santé, et plus particulièrement pour les maladies non transmissibles, est prise en compte avec des investissements forts qui sont faits dans ce domaine, car il vaut mieux prévenir la survenue des maladies non transmissibles que d'attendre qu'elles soient là, car du moment qu'elles s'installent, elles restent pour la vie.
Thank you very much, Dr. Dango. I believe, Dr. Nyamongo, you'd like to add something to this.
Yes, thank you. Just to say that although the literacy levels are increasing on NCDs, we still need more investments in health promotion. If you look at the way our countries fund health activities, a lot more resources go into curative care, very little goes to health promotion, health prevention, and therefore the need to intensify how we reach communities in a language that communities understand, and also pay emphasis on NCDs globally. So if you look at NCD funding in a lot of our countries is very, very low. And even if the funding is there, then it goes into curative, it goes into treatment centers rather than in health literacy. So we would like to see a situation where health promotion activities get more funding, health prevention, even just beginning from schools, instead of sacrificing physical activity for in-class activity. So ensuring that lifestyle changes become part and parcel of what we discuss within health systems and support that a lot more strongly than it is being supported now. Thank you.
Thank you very much, Dr. Nyamongo. So this question, Dr. Moeti, is to you. It's from Victor Olwok. Victor writes from the Daily Nation in Kenya. And I think the thrust of the question really is what the fallout will be from COVID-19. Do you foresee sectors that would have benefited from more investment as a result of COVID-19? And do you see sectors that would have been disproportionately weakened as well as a result of COVID-19?
Yes, that's a very important, tough, and current question. I mean, we have seen, of course, that the impact of the pandemic, and even more so the immediate and significant impact of the physical and social distancing measures that were imposed, that had to be imposed by governments in countries, the so-called lockdowns, has had very profound impacts on many sectors. I would say that, of course, the health sector has been hugely impacted. We've already said a lot of what was happening in health in terms of prevention and management of illness initially was, in a sense, put on a back burner, while a lot of resources, attention was paid to the COVID-19 pandemic response. A lot of work is being done now to catch up and to emphasize that we need to do both. But the health sector has been impacted hugely. I would say that sectors that require people to be together and people to travel are some of the ones that have been most dramatically impacted. So the international travel, the tourism sector, the sectors that are dealing with the arts, where people gather to look at what is, to be part of audiences of various activities. Sectors like sport have been very significantly impacted. It's only now in some countries that the resumption of these is happening. Education has been very much impacted because, again, in education, you get children gathering in schools, and I'm sure you're following all the debate in different countries about restarting education activities, whether to have virtual sessions, whether to resume in-person sessions, both at different levels of education in countries. We've seen, of course, different economic sectors that have been affected. So if you like, the entertainment, hospitality, hotels, restaurants, the personal care sectors, the retail sectors as well have been impacted. I believe that agriculture, in some senses, although not altogether, in some countries has escaped in terms of severity, the impact of COVID-19. Although, as Mary mentioned, the lockdowns in terms of transportation, of materials, of supplies has meant that some of the inputs for agriculture have not been able to arrive in time for the planting and the seasonal, because agriculture is very much determined by seasons. Things have to happen at specific times. And this also has had an impact in some of the sectors. I guess we could say that the one sector that has been positively affected has to do with technology for communication and being in contact remotely. This is one sector which has, in a sense, come into its own, where we have all had to rely, as we are doing right now, as has been done for trainings to respond to the pandemic, for education of children, for sporting activities, people to watch remotely. That's one sector that has had to step in and be used for all sorts of things, including for retail. So instead of people going shopping physically, they could place orders and have deliveries. This again has been using technologies. So it's had a very profound impact on development, on many development sectors. What we hope is that we can leverage the lessons that have been learned about more efficient ways of using technology for development, including for health, education, different sectors. I'm hoping very much that for Africa, it can spur on investments that can make this affordable for people at different levels of the socioeconomic ladder, so that we can have a more leveling of the playing ground and people having access to information, services, using technology, while the more traditional sectors, of course, recover, so that people are able to continue to regain their livelihoods, and the huge impact that we've had on general economic growth in countries can be recovered from progressively.
Thank you, Dr. Moeti. Dr. Mweemba, perhaps you would like to contribute something towards this. I know earlier on you did mention that you are using more insulin in treating patients who are diabetic, as opposed to the oral medication that you normally would use. So are you seeing sectors that are benefiting more and those that are falling behind as a result of COVID-19?
Yes, so just like I said, is that obviously insulin tends to control the sugars better than the other medications that we use for diabetes. There are different patients. Patients that already know how to use insulin tend to do better because then they can give themselves the injections than a patient who's new. And depending on how much other drugs that we give that can worsen that sugar, it means that the patient might last longer in the hospital than someone who has fewer drugs that you're giving. For example, an individual that is being given some steroids, drugs that we use to just control the immunity, is that they might stay longer in the hospital because the other drug that you're giving also worsens the sugar control. And so, yes, it depends on an individual, and some individuals tend to stay longer. Obviously, the diabetics, as compared to the hypertensives, we tend to keep them for a longer period of time because we need to teach them a number of things that they need to learn about injecting themselves. Even when they go home, some of them recover, but some of them up to now, for example, the people who have discharged maybe 3 months ago, we're still struggling to just maintain their sugars. And partly, like earlier alluded to, this could be because some of them cannot access insulin from their pockets.
All right, thank you very much, Dr. Mweemba. Dr. Moeti, if I could ask you to please answer this question. It's from the BBC. So the question is from Rhoda Odiambo. So she's saying that Kenya has amended its burial protocols, but that the health ministry hasn't, updated these guidelines to say whether or not a corpse is still infectious, because according to corpses cannot transmit COVID-19. Is this a sentiment shared by the WHO? What is your comment?
Okay, I think that, of course, the COVID-19 is a new illness. It's primarily a respiratory illness, although, of course, it does have systemic effects all over the body. That's been clear, and that it's primarily transmitted through droplets from the respiratory tract, which is why when we test for the virus, we're testing generally either in the mouth or the nostrils. So I think that, if I may respond and say it's not a virus that we think can be transmitted from contact with other body fluids, for example. We have seen procedures to manage dead bodies that are somewhat reminiscent of what is done in the context of Ebola. I think what I can say is that we're continuing to seek to understand this virus and how it is transmitted potentially from a dead body, but some of the burial protocols could be less demanding than for a disease like Ebola. WHO is constantly reviewing our guidance on this so that we can strike a balance, let me say, in terms of caution, but also enable the management of the process in ways that is not beyond what are the demands of what is largely a respiratory infection. So I'm not sure to what degree, what exactly the Kenyan government has done in relaxing some of the requirements for the management of dead bodies, and we can look into this and continue to provide further information for people. What I have observed is that there is a tendency to very much be linked to what was initially quite draconian prevention measures. We're understanding these may not be essential, but we need to really hit the balance and update our guidance so that people do what's necessary and what's essential to manage the burial of the dead safely.
Right. Thank you very much, Dr. Moeti. If you'll allow me to please pass on this next question to Dr. Ncanggoy. It's from RFI Lucille Moulard, and Lucille wants to know what the effects of combating COVID-19 are as in how's the flooding impacting on these efforts, mentioning places like Niger, Sudan, Burkina Faso, and other countries. Is the flooding negatively impacting efforts by these countries to fight COVID-19? Dr. Ngoy? Dr. Ngoy, are you with us? Okay, we don't seem to have Dr. Ngoy with us at the moment. If I could ask you, Dr. Moeti, to perhaps just weigh in on this. What reports are you receiving from countries about flooding and how it's impacting on their efforts?
Oui, oui, oui. OK. Donc, merci beaucoup. Comme ça a été demandé par RFI, je vais répondre en français. Merci pour cette question très importante. Sans doute, il y aura des perturbations des activités de la prévention de COVID-19 à cause des inondations dans ces pays affectés et aussi les impacts sur l'accès aux services essentiels pour la santé, les services comme la vaccination pour les enfants, le traitement pour les personnes qui ont quelques maladies prioritaires comme le paludisme, le VIH, etc. Ça veut dire que les personnes qui doivent, par exemple, venir se présenter aux formations sanitaires, s'ils ont des signes de la maladie, peuvent pas y arriver. Et ça veut dire aussi que les activités de suivi de contact, l'isolement des personnes qui doivent être isolées va être perturbé par les inondations. Donc, c'est un problème qui s'ajoute au problème déjà dans quelques pays où il y a beaucoup de défis dans la capacité du système de la santé de faire face à cette pandémie. Et nous sommes en train, à travers nos bureaux pays et d'autres partenaires, de travailler avec le gouvernement pour les aider à ajuster ce qu'ils font à cause de ces inondations. Donc, c'est une difficulté, en fait, pour la réponse à la pandémie.
Thank you very much, Dr. Moeti. Let's just get to final responses from all of you. I'll start with you, Dr. Nyamongo. Dr. Moeti spoke earlier on about multi-sectoral partnerships. What do you think we ought to be doing, especially in dealing with NCDs as we try and whittle down the numbers of COVID-19 infections?
Thank you. Just to go back to the most affected sectors, but also the most affected populations, just to talk about the very poor, the ones in informal settlement, the ones who've lost jobs, the ones who don't have prospects for the near future, the need to get into partnership with other private sector, other development partners, to ensure that we provide a safety net for these populations, especially if they have a child with sickle cell, if they have a child, somebody suffering from cancer. These families are suffering. So as a global community, they need to really look at the fate of the poor, the marginalized, and on top of their issues, their normal issues in terms of poverty, they have to deal with NCDs, and on top of that, they have to deal with COVID-19. So we need to put a lens on the poor in the informal settlements who have NCDs and other comorbidities. Thank you.
Thank you very much, Dr. Nyamongo. Dr. Mweemba, your final word on treatments, what improvements can be made as we go forward?
I think I would love to mention that so COVID-19 can cause a number of NCDs, including diabetes, hypertension, chronic lung disease, kidney disease, and these can be managed well. I think that from our center, we've realized that if patients get to us early enough, it seems that we are able to control these NCDs and their discharge as well as possible. Like I mentioned earlier on, our mortality is like less than 1% because I think that the referral system has worked very well to refer these patients early enough, and we are able to manage them very well. Obviously, going forward is that we need, as governments in Africa, to ensure that we budget enough for NCDs. As we can see now, we are struggling just because probably we have not done enough to cater for NCDs. Thank you so much.
Thank you very much. Dr. Dango, we spoke earlier on about preventative measures, but also early diagnosis. So in relation to NCD, COVID-19, what can we do going forward?
I will start this time by responding in French, if you allow me.
Please go ahead.
Je pense que la lutte contre les maladies non transmissibles n'est pas seulement la gestion des maladies, mais c'est aussi et surtout la prévention. Donc, éviter que les populations ne tombent malades, éviter que les populations aient ces maladies chroniques, ces maladies non transmissibles. Donc, il est important, en cette période de pandémie, de ne pas seulement focaliser sur les personnes souffrant de maladies et de conditions non transmissibles qui arrivent dans les structures de soins parce qu'elles ont des signes de la COVID, mais aussi de faire un travail en amont et donc de lutter contre les facteurs de risque, en particulier les facteurs de risque modifiables, que sont le tabagisme, que sont la consommation excessive d'alcool, que sont l'alimentation malsaine et bien entendu l'inactivité physique. Et donc, il est important d'inclure dans la réponse à la COVID-19 la reprise et le renforcement des services essentiels de maladies non transmissibles dans les structures sanitaires et dans la communauté. Now, moving to English, I will repeat what I said in French. It's of paramount importance when dealing with COVID-19 pandemic also to insist and strengthen the activities and the interventions aiming at preventing the occurrence of non-communicable conditions. And so we can act on unhealthy lifestyle, such as tobacco use, harmful use of alcohol, unhealthy diet, and physical inactivity. These are very important risk factors around which we are now experiencing some myth when it comes to COVID-19. Be aware that tobacco use is not a preventive factor against COVID-19. It's a risk factor for getting COVID-19. So let's all be aware of that and continue combating unhealthy lifestyle.
Thank you so much, Dr. Dango. Dr. Moeti, we'll end with you. You mentioned telemedicine earlier on, and I was quite intrigued by that. Where do you see the future of that going, especially within the context? And I'd like to also, while you talk about that, looking at poor households that you mentioned, can they benefit from this? Will it be a cost-saving measure for them in one way?
Yes, I think that, you know, technology and innovation using technology is a really powerful tool that is helping us deal with the pandemic and can help us deal with many aspects of development, including in health after this pandemic, including for low-income families. So I really believe, you know, if you look at some of the examples of using technology to move money in some of the cases, and since Mary is here from Kenya, Kenya has been a leading country in that. So people who don't even have bank accounts, who are in low-income families, have been able to conduct business, move money, have been able, if they're farming, to have access to information about the weather and how it relates to their agricultural work, have been able to have access to information about agricultural prices and decide how to price their own goods. So I think with innovation, there can be aspects of this technology that are affordable to people even at the lower socioeconomic scale. And I think that this pandemic experience is showing us that this is a public good. This is something that can work for the whole of society, for even the most vulnerable households, the most underprivileged people. And it is incumbent on governments to make the policy and the private sector and the innovators to work together to make access to technology, well, telemedicine as an example, but technology for development to people everywhere. Because this is, if I take Africa as an example, this is a tool that can really fast track and help us to jump through some of the gaps that we have in development, including for health, including for controlling pandemics, including for educating children, including for expanding access to business and expanding livelihoods in Africa, and including for recovering from this very pandemic. So I hope that we go away with the lesson of massively investing in affordable technology for people at all phases of life in different economic statuses, so that it can be a powerful tool for development. I'll stop there. Thank you.
Thank you very much, Dr. Moeti. Thank you very much to all of you for a very enriching discussion. Dr. Matshidiso Moeti, the WHO Regional Director for Africa. Thank you very much, Dr. Aggrey Mweemba, who's the head clinical care at Levi Mwanawasa University Teaching Hospital. Thank you very much as well to Dr. Mary Amuyunzu-Nyamongo, Executive Director, African Institute for Health Development in Nairobi, Kenya. And thanks as well to Dr. Jean-Marie Dango, who's the Coordinator NCD Program at the WHO Regional Office for Africa. That's how we bring to an end this session of the WHO APO Group online briefing on COVID-19. Thank you so much for joining us, colleagues, and wish you all a very good day further.